Hi, my name is Erin. I'm going to be the speech-language pathologist conducting your clinical swallow evaluation today. I'm going to start off asking you a few questions regarding your swallowing. So first, do you feel that food ever sticks to your throat or your chest?
No.
Okay. Do you ever feel pain when you swallow?
No.
Do you ever feel that food is going down the wrong pipe?
No.
Are there any foods that you eat that cause any of these problems?
No.
Do you experience heartburn or coughing when eating?
No.
Any acid reflux?
No.
Do you have trouble swallowing pills?
No.
Do you ever experience dry mouth?
No.
And what do you typically eat in a day?
For breakfast, I usually have yogurt or cereal. For lunch, just like a salad, and then dinner, like chicken or steak with rice or whatever.
Okay, thank you. And then next we'll move to your general medical history. So are you currently taking any medications?
No.
Do you have a history of any kind of pneumonia?
No.
Have you ever had a tracheostomy or a trach pipe placed?
No.
Have you ever been on a ventilator?
No.
Have you ever had a chest x-ray?
No.
Have you ever been on a feeding tube?
No.
Do you have any history of congenital disease?
No.
Is there any history of neurologic diseases such as a stroke or a traumatic brain injury?
No.
Have you had any recent surgeries?
No.
Do you have any respiratory impairments such as asthma or COPD?
No.
Have you ever been diagnosed with any esophageal diseases such as GERD or achalasia?
No.
Okay, thank you. Okay, next we are going to do an oral mechanism exam. So I'm just going to be looking at the structures in your mouth and making sure everything looks normal and that it's functioning properly.
Okay.
So first, can you make sure you're sitting up at a 90-degree angle for me? And then I'm going to have you open your mouth. Okay, I was just looking to see if there was any asymmetry or inflammation or any abnormal movements at rest, and you didn't have any, so that's really good. Next, we're going to check your jaw movements and the strength of your jaw, because that's really important for chewing. So first, can you just open your mouth like this for me? And then close it. And then I want you to open it, but this time I'm going to put a little pressure, and I want you to open it against my pressure. Good. And now the reverse. I want you to open your mouth and then try to push up while I'm applying pressure. Okay, good. And now last thing, can you move your jaw side to side for me? And then protrude your jaw forward like an underbite, like this. Okay, good. So I didn't see any restrictions of jaw movement. And then the last thing I want to check is, can you just bite down like normal for me? And then pretend like you're chewing. All right, all of the muscles seem to be working right. Next, we're going to look at your lips, the movement and the strength of your lips. So first, can you pucker your lips for me like this? Okay, and then smile. Everything looks symmetrical. And then I want you to puff air into your cheeks like this and hold it in, good. And it looks like you have good lip strength, which is good. You have a good seal so that no food or liquid will spill out when you're chewing or eating. So next we're going to look at your tongue movement and strength. So can you stick your tongue straight out for me? All right, everything looks symmetrical and there's no fasciculations or atrophy of the tongue. And then can you stick your tongue out and move it side to side for me? Okay. Now I'm going to use the tongue depressor. I want you to stick your tongue straight out for me and then resist the strength. All right, and now off to the side and push against it again. And then this side as well. Okay, good. Now I want you to pretend that there's peanut butter on the roof of your mouth, and I want you to try and scrape the peanut butter off from front to back. Good, you have good tongue elevation. And lastly, can I just see your tongue elevate outside of your mouth like this? Good. All right, so then next we're gonna test the overall sensation of your face and your facial structures. So I'm going to touch one side of your cheek, and I want you to raise the hand of whatever side you feel me touch it on.
Okay.
So first, can you close your eyes for me? Okay, everything looks good.
Thank you.
Now I want you to say ah for me. Good. I saw a good velum elevation and your fascial pillars look good. Next, we're going to test your gag reflex. It's not going to be too scary. Okay. Good presence of gag reflex. Next, can you cough for me? Like, good. And then can you clear your throat for me? Like, good. So that's good because if anything does get stuck or go down the wrong pipe, you seem to have a good ability to clear it out. So last, we're just going to look at your laryngeal elevation during a dry swallow. So I just want you to pretend like you're swallowing food like you normally would. Okay, it appears that you have good laryngeal elevation. Thank you. We're done now.
Thank you.
So now I'm going to be testing your swallow and the timing of your swallow.
Okay.
So I'll be placing my fingers on your throat like this, and I'm going to have you try different foods and liquids, and after every swallow I want you to say ah, and that's just for me to hear if there's any gurgling noises, to make sure that there isn't water or liquid or food going into your lungs.
Okay.
Okay, so the first thing that we're going to do is take a little bit of water on the spoon. Good. Okay, and now I'm just going to be taking a little bit more water on the spoon. Very good. Okay, so now I'm going to give you a sip of water from this cup. Very good. And now I'm going to let you take a sip on your own.
Okay, I got it.
Very good. And now I'm going to have you take a sip from the straw. Very good. And now you can take a sip from the straw on your own. Just one sip. Very good. And now you can take 2 sips in a row.
Okay.
Very good. Okay, so now we're going to be using pudding.
Yummy.
For the first one, we're just going to put a little bit on the spoon. Let's get some of this off. Okay. Very good. And now I'm going to be taking a tongue depressor, and I'm just checking to see if there's any food residue inside your mouth. Very good. Okay, and now I'm just going to take a little bit more pudding. Very good. Gonna be checking again. There's no food residue. Very good. Okay, now we're going to take even more pudding on the spoon. Very good. Check again. And there's no food residue. Very good. Okay, so now I'm gonna have you take what you would normally take on your spoon. I'm gonna put my hand over here. Very good. Let's check for food residue. And there's none. Very good. And so now I'm gonna actually be using mac and cheese. So I hope you're ready for that. And we're gonna start with about half a spoon, or fork in this case. Very good. And once again, just checking for food residue. Okay, there is none. Okay, so we'll do a little bit more this time. Okay. Good. And there is no food residue inside of the mouth. Okay, so now this time I'm gonna have you take what would be a normal spoonful for you. And I will be checking my hand.
Good.
Very good. And there is no food residue inside of the mouth. Okay, so that actually concludes the food trials. So next I'm just going to be telling you about some recommendations and food safety recommendations. So based on the observations I've made, I don't recommend any further treatment or swallowing treatment. I recommend any food textures, or if there's no dietary restrictions based on what I've seen today. Everything was within normal limits. And just some normal safety guidelines as a rule of thumb is to maintain an upright position, so near 90 degrees when you're eating, and to take small bites, such as maybe like half or 1 teaspoon size bite every time you eat. Make sure you chew your food thoroughly before you attempt swallowing. As also alternate small bites with taking a sip of a liquid, whether that's water or whatever liquid you may be drinking. Eat slowly and avoid talking while eating, avoid like distractions while eating, and just make sure you check your cheek for any pocketed food after you're done, as well as just eat in a relaxed and comfortable environment. And as a general rule of thumb, it's really important to have a good oral hygiene. But yeah, besides that, everything seems to be in order, so I have no other further recommendations.
Okay, thank you.
Thank you.